A businessman.
Okay.
Buying and selling.
How do you think the cost of living has affected your work and your general livelihood?
So many people are hungry. Oh. To survive now, you see some people walking the streets, you think they are sick. It's a lie. Oh. They're hungry. Oh. So this economy is bad now. Our government should find solution.
Seriously, Nigeria is worse now. It's still getting worse now. Things are just, I don't know how to put it, but things are worse now.
Well, due to the nature of my business, it's not really affecting to me based on it's things that are related to food. People must eat. People must eat. So if you want to live, you have to buy and eat. So to me, the things is not affecting person like me, but I don't know about that. But people are complaining, especially customers.
Before now, the price of things in the market used to be like very, very good for sellers and buyers. Like business ideas used to like help a lot of people, but now it's just crazy.
Money no dey, aunty. No money. I carry groundnut, 6 cents money. I no fit sell am. Nothing. Market no dey. People no go fit buy am because our money no dey.
Say we fit do both us or both government or both anybody wey get money o. Wetin you feel say we fit do to help the country?
Make the country may help us, make them reduce the fuel.
Okay.
So that you go reduce the fuel, us must say it better for us. Transport must say it cost. To carry and come.
And the transport dey affect wetin we dey sell, ba?
Yes, it affect well. Now how much? Now 1,000 carry and come here.
Hey.
It can help in so many ways. For starters, price of fuel can come down.
Okay.
Great job opportunities.
Okay.
If that's possible.
Okay.
I feel like they know what they're supposed to do. Truth be told, they know what they're supposed to do, but God's willing, maybe their heart might be touched someday to help the masses.
Nigeria should improve on their security.
Okay.
I think they have much forces, but the security is some kind of bit. It's not much like that.
Okay.
So insecurity is more than kidnapping issues.
Okay.
The nature of the government, no matter what you said, they can't do anything. They are on their own. They do what they like. Even though I say they should do something, they can't do anything. So we'll be watching them. It's just what I believe that, on a good day, if youth or the citizen can analyze and do the needful. If not, government cannot do anything.
And we are done. Thank you for joining us.
Sannunku kowa da kowa, mun kawo muku gaisuwa da kowa gayyata zuwa taron jinsi na wannan shekara 2024 wato Gender and Inclusion Summit 2024. Wannan kibiyar namu Policy Innovation Center tana wa fili gayyata zuka kare daga kungiyoyi daban-daban ku zo mu haɗa kai. Burinmu shine mu tattauna hanyoyi da za mu rage talauci a Najeriya. Mun gode, sai mun ganku.
This poverty, they say get different faces. So sometimes if it be man face, another time na woman face, even self if it be pikin face. Everything around us they show this poverty. Road o, house o, hospital, even the market sef. They say as the poverty they show. This year, for our big town hall meeting wey we dey call Gender and Inclusion Summit, na all this plenty matter na we go dey talk about. We go dey answer question. How they even fit reduce this poverty? E get how we go take touch people wey be say our roads will become better, our people fit live better lives. The question to answer many and the thing to talk about plenty. So when we come that town hall meeting, different people go dey inside that room. Now this matter, now we go dey talk. And one thing wey go happen be say, you sef fit join us. Now for Abuja Continental Hotel, September 4 and 5, I go see you for there.
Bonjour à tous, je m'appelle Simon Jonah et je suis ravie de vous inviter au sommet sur le genre et l'inclusion. Cette année, nous nous concentrons sur la reimagination des parcours et des partenariats inclusifs en matière de genre pour la réduction de la pauvreté. Et devinez quoi? Le sommet s'adresse à tout le monde. Donc, que vous soyez un décideur politique, un défenseur ou simplement quelqu'un qui est passionné par l'idée de faire une différence, venez travailler ensemble pour créer un changement durable. Merci et rendez-vous là-bas.
Habari, jina langu ni Dr. Mary Jimo kutoka PIC. Nina furaha tele kuwakaribisha Abuja na kuwakaribisha Nigeria. Tutakuwa tukiongea maneno kuhusu umaskini katika Gender Summit 2024 hapa Abuja. Tunataka kuongea kuhusu vile umaskini inabadilisha maisha ya watu hapa nchini na vile tunaweza kufanya suluhisho ili watu watoke kutoka hii umaskini. Karibu Abuja, karibu Nigeria. Asante.
Hello ladies and gentlemen, my name is Amari and today I am representing Policy Innovation Center. It is about to be a bomb. The Gender and Inclusive Summit 2024 is happening soon and the theme is reimagining gender inclusive pathways and partnerships for poverty reduction. I am super excited. We are on the streets of Abuja and we are going to be asking people questions, knowing what their take is on the current situation of the economy and of Nigeria. Come with me. What do you do for a living?
I'm a student. I'm doing my IT for now.
Na groundnut that they do. That my business be that.
I'm a barber, as you can see.
Yes, sir.
I'm an entrepreneur. I have some basic skills based on the hardship of the country.
I'm a businessman.
Okay. How do you think the cost of living has affected your work and your general livelihood?
So many people are hungry. Oh. To survive now, you see some people walking the streets, you think they are sick. It's a lie. Oh. They're hungry. Oh. So this economy is bad now. Our government should find solution. Oh.
Seriously, Nigeria is worse now. It's still getting worse now. Things are just, I don't know how to put it, but things are worse now.
Well, due to the nature of my business, it's not really affecting to me based on it's things that are related to food. People must eat. People must eat. So if you want to live, you have to buy and eat. So to me, the things is not affecting person like me, but I don't know about that. But people are complaining, especially customers.
Before now, the price of things in the market used to be like very, very good for sellers and buyers. Like business idea used to like help a lot of people, but now it's just crazy.
Money no dey, auntie. No money. I carry groundnut, 6 cents money. I no fit sell am. Nothing. Market no dey. People no go fit buy am because our money no dey.
Say we fit do both us or both government or both anybody wey get money. Wetin you feel say we fit do to help the country?
Make the country may help us, make them reduce the fuel.
Okay.
So that you go reduce the fuel, us must say better for us. Transport must say cost. To carry and come.
And the transport they affect wetin we dey sell, ba?
Yes, it affect well. Now how much? Now 1,000 carry and come here.
Hey.
It can help in so many ways. For starters, price of fuel can come down.
Okay.
Great job opportunities.
Okay.
If that's possible.
Okay.
I feel like they know what they're supposed to do. Truth be told, they know what they're supposed to do, but God's willing, maybe their heart might be touched someday to help the masses.
Nigeria should improve on their security.
Okay.
I think they have much forces, but the security is some kind of breeze. It's not much like that.
Okay.
So insecurity is more than kidnapping issues.
Okay.
The nature of the government, no matter what you said, they can't do anything. They are on their own. They do what they like. Even though I say they should do something, they can't do anything. So we'll be watching them. It's just Well, I believe that, on a good day, if youth or the citizen can rise and do the needful. If not, government cannot do anything.
And we are done. Thank you for joining us.
we are here physically is digital based. And in particular, for advancing women's health, it gives us an opportunity to reach a multitude of people across demographics, across communities, and age ranges, and even just literacy ranges. And so it's very important. We've seen how digital has essentially been how people in rural areas access, digital. They have access to Facebook. They have access to TikTok. I mean, we see people making content in these spaces, and so it's very important to be able to leverage those, the technology of digital to be able to speak to these groups of people, in particular, groups who are actually advocating or who are in these spaces. Like, for instance, we were able to create we had an MNCH program recently where we created some, CTAs and some community action guides. And those were all digitally available, almost like a toolkit for advocates, for medical students, for anyone who's in this work, for nurse practitioners, for traditional practitioners. They all have access to this digitally, and so this is an important way that we found that is crucial to to essentially helping us bridge this gap, between the women who need access to important medical, infrastructure and resources.
Thank you, Fefe. Now, you touched on a point about digital being a very important tool in actually increasing reach. Tolu, we've worked together for years. Funny story, I did not know my Tolu was going to be here, so this is actually a big surprise for me as well. So in your years and your experience working in financial inclusion or women's economic inclusion, I know you've had experience working in women's health as well. Please share with us, describe this work and how we can actually, how financial inclusion, especially the digital aspects, kind of incorporates into all this to increase access for women.
Thank you, and good morning once again to everyone, and thank you, Rhoda, for having me on this panel with such brilliant and fantastic panelists. And I would say that what Tomi initially said about the statistics as not being encouraging is actually the case. It's true, it's the reality, not just in Nigeria, but across Africa. We have, currently we have, according to the IMF 2023, we have 38% of women having bank accounts and 48% of men having bank accounts. And this ownership of bank account does not even translate to the usability of bank accounts to improve their lives and their livelihoods. So the question is, what are we doing about it? And I've been very fortunate to have a huge part of my career dedicated to women's economic empowerment, understanding what are the drivers of women's economic empowerment. Why is it that we still have a huge number of women that are not using, accessing and using financial services for their own, to improve their lives and to improve their livelihoods? And when I mean their lives, then I'm talking about health. Health is one of the reasons, one of the major life events that women go through. Everyone like we all have healthcare needs, but for women it's even more dire because we go through menstruation, we go through childbearing, or we go through menopause. So what are the financial services and products that are available? And I have some very data. I'm going to also add to that statistics. In the health insurance coverage in Africa is abysmally low. And I'm going to read out a brief. In DRC, we have 6.1% of the women that are covered by any kind of health insurance. In Cameroon, we have 1.1%. In Burkina Faso, 0.4%. And all these countries are in West Africa. In Nigeria, we have only 2.8% women that are covered by any health insurance. So the question is, what are we doing about it? And when I mean we, I mean the financial service providers. I mean the development organizations. I mean the government itself. So when we now translate 2.8% of women that are covered by one form of health insurance, that means majority of the other women that are not covered are paying out of pocket. They are paying out of pocket to access maybe family planning is quite accessible because the government has made it so. But if you were to get Implanol is what is the family planning that you put on your hand, then you have to pay out of pocket. If you have to have cesarean section, you have to pay out of pocket. So how many women, and we are seeing that these numbers, maternal mortality rates in Nigeria is climbing despite everything that is being done. The question is, how do we begin to leverage digital innovations to design appropriate products? And I will still talk more about this, but where we are right now is not where we want to be. And that is the beauty of having conversations like this. And we've seen this, I have seen this not just in Nigeria. We are doing some great work in Mozambique. We are doing some great work in Uganda and in Kenya, where we are collaborating with the financial service providers, fintechs, to develop digital health products for women. So, but I will stop at that.
Okay,
Thank you very much.
so much. Tolu has raised some very cogent points, especially around women's access and to financial services and financial products, which kind of puts one of our other speakers on the spot, since he actually runs a financial service provision institution or bank. Just before I go to Mr. Nyogo, I would like to introduce our last panelist who has joined us. Please welcome Ms. Ini Dima Okoji, who is a prominent Nigerian actress and who has transitioned from a successful career in investment banking to a vibrant world of acting. And she has been able to make significant strides in African entertainment while also impacting the realm of women's health through her advocacy and support. Welcome, Ini.
Thank you. Good morning. Thank you for having me. I'm so sorry I'm late. My flight was a little delayed, so I snuck in, but I'm here now.
Thank you so much for having us. Okay, so, Mr. Nyago, now, Tolu has raised some very, very important points about less than 40% of women actually having banking accounts. And if you look at the statistics and relating it to the fact that over 70% of small-scale farmers are women, this is giving you that we have a lot of small and micro entrepreneurs who are women without access to financial services. Now, in your institution, how have you been able to manage this, and how have you been able to support women to have access to financial services?
Good morning, and thank you for having me. We are not dwelling here on problems. We're not dwelling on challenges. We've come to find solutions. And that is what we will do. And that is what we are doing at AG Mortgage Bank, which I will use as an example to typify what financial institutions ought to be doing and should be doing to improve the situations, the dismal situations that have been mentioned. The first thing we need to do, and we are doing in AG Mortgage Bank, is our product design. Our product designs must be done in such a way and are being done in such a way that they are gender friendly. I'll just give some examples. You don't just design, you don't just give a lady ice cream, vanilla ice cream. She prefers a strawberry ice cream. So make her a product that will look like strawberry ice cream, and she will be with you. And that's exactly what we are doing. We mention as we go on in this program some of the products that we have designed along those lines. The second thing we do to improve on gender inclusion is the pricing of those products. Are those products priced in a friendly manner? Women are actually, from my experience, and I'll tell you where I derived that experience, I have 6 of them in my house, my wife and my 5 kids. They're all girls. So I am in the midst of women, so I know them inside out. So pricing, they are not complaining about the cost per se. Women are good negotiators. They negotiate for everything. And so what they want to see is a situation where you give them something slightly different from what you give to the entire market. And that's exactly what we do in AG Mortgage Bank. We have come up with a different pricing structure for women customers, or even businesses led by women. In terms of interest rate, we charge them prime instead of prime plus. In terms of, there are certain products we give for free, and that has helped to give them that differentiation that is important. And thirdly is how you deliver. How do we deliver? What platforms do we, what channels of delivery do we have? If you want to sell your products and to a church woman, you want to bring technology that is strange, that will create problems of women issues. It's here. Ngozi will not want to deliver her products on Twitter. She rather will go to Instagram. She would rather to go to TikTok and all those kind of delivery channels. And so that's what we have learned, and we'll continue to share our experiences around that as we continue.
Thank you so much. Now, you've touched on a lot of points, especially on the fact that in all the products that you've been designing, data has informed that design, understanding the people that you're designing the product for, understanding their needs, their preferences, and how they actually access information. Now, Dr. Sesson, with all this information that we have, and with the number of new data and research that is coming out, why do we still have these disparities in health access and in financial inclusion?
Thank you very much, Rhoda. And good morning, everyone. And I think one thing that we are all here about, or that we all care about here, is that we still have very high maternal mortality and morbidity rates. And there are several different things that are responsible for it. Firstly, we talk about socioeconomic status. A lot of women don't have the means, just like the CEO just talked about. Also, there are also challenges in terms of education, taking that, being able to know and take decisions when you need to have care. There are issues that have to do with our culture. In some parts of the country where there is a heavy patriarchy, taking a decision to go to the health facility in the absence of the husband, it can be a death sentence or even a divorce. It can be a reason for divorce. So imagine if the husband is not around in that scenario and the woman is laboring. So those are the kind of reasons why we still have challenges. There are, however, those are not the only issues. There are also issues that have to do in terms of access. Yesterday I was talking with one of my colleagues, and we're talking about conducting a kind of mapping exercise to see where health facilities are located and where the people live. You know, we talked about that when he was doing some work in Kaduna State. And he was telling me that you will find healthcare facilities isolated, you know, far away from where people live. So if people want to access those facilities, how do they get there? Now, there is the added factor of insecurity. Insecurity is not just affecting only the people who want to go there, even the health workers. Health workers many have been maimed, many have been raped, many have been killed in the course of conducting their assignments. So there are several challenges that need to be overcome. Now, added on that, we have health worker crisis. There's a lot of exodus from the health system, and there is significant shortage. Um, we talk about organized absenteeism. So it's not just that people are even short; those that are now even supposed to work, are they going to the work? Yet they are being paid for it. So those are peculiar challenges that keep holding us back. When it comes to in terms of ability to use the digital devices, um, we need to look at it from perspective of how many women have these devices. First of all, how many of them can actually navigate? What proportion of them can navigate? Using these devices to be able to access care. So those are peculiar issues on in terms of access using digital platforms, and the how we take it on. I think I'll leave that to you. Thank you.
Thank you very much. I'll still throw that back to you again because I'm not here to answer all the questions. Mine is just to ask questions, thankfully. You had said a lot, and you had also mentioned the fact that there is education also has a role to play in limiting access and uptake of healthcare services and even financial services as well. And of course, the JAPA syndrome. I think one of the sessions yesterday had also spoken about the JAPA syndrome and how we are losing a lot of our resources because of the downturn of the economy and people searching for greener pastures. And I would like to come to you, Ini, with your platform. You have a very wide platform. When we are looking at those who actually have access to digital platform and can access digital information, how have you been able to leverage on your platform as an entertainer and as an advocate to increase access to information, the right kind of information for women's health and finance?
Good morning again. So, as someone in the public eye, I recognize the power of storytelling in influencing change. And when I shared my personal fibroid journey on social media, it wasn't just about raising awareness. It was about starting a conversation that a lot of women felt they couldn't have. And the vast, the outpouring of responses just showed me the number of women that were suffering in silence. And I think that that is where creative and digital platforms come in. By using these platforms, we can reach women that may not have access to traditional healthcare information, or women that feel isolated in their experiences. And that's the thing about digital media. I feel like the visual and, let me say, the narrative-driven nature of it
requires a lot of data to be able to parts of communities like Akwa Ibom and Enugu and different places where they can't access the film on YouTube because they don't have data. But what we can do is we can gather stakeholders like everyone else here on this panel together and watch it with them, have these discussions with them, have people there where they can access, they can give their information to get access to. So it has to be a hybrid strategy, essentially, if you understand what I'm saying. But in addition to that, we have to improve digital literacy and access for women in keeping up with global digitalization trends. And that's also where a few people also on this panel can come in handy. This is where influencers like Ini can come in handy in helping to, drive interest to these types of workshops and sessions. And of course, people like, FSD and the financial services people and medical practitioners should all come together. Of course, and work together to essentially create these platforms for educating women on digital literacy. And of course, last but not least, we should make sure that we're creating socially responsible and culturally relevant content, right? That resonates across all contexts of demography, across really the different pieces of the information, from the actual product to the situation that the women may actually be facing, which differ across demographic. Thank you.
Thank you. Before I move on to the next speaker, PIC, the host of the Gender and Inclusion Summit 2024, Would appreciate feedback from all participants of this session. To do this, please scan the QR code or go to the feedback stand where research assistants can support you, and you can use the big screens on the foyer as well to give your feedback. Please give nice feedbacks. Thank you. Okay, now Fife, you had talked about how it's very important to kind of make that bridge, that connection between the digital and community. And I second that as very important. I remember in Haiti, we do something similar where, of course, when we have informative and educative content that most of the time you only see on the internet. And then we have communities where internet is an issue and where USSD is the only form of stable connection that they can actually have. You actually have to go to the communities and use the available resources like football viewing centers, community halls, and hold this kind of dialogue sessions and sit down and show these movies and use them as tools to actually educate people where they are and not expecting everyone to be on the internet and being blind to the fact that everyone has different realities and different access to available resources as well. So I think that's very key when you're looking at inclusion and when you're looking at healthcare for women as well. And I think this would lead me to back to my question to Tolu on how do we actually integrate this kind of a gendered lens and intersectional lens in people's realities, and how do we integrate that into the design of financial and health service interventions?
So thank you very much. And this is the question that I absolutely love because it speaks to the core of my work across Africa. For a long time, I don't know, maybe 20 years ago, when the bank started designing women's products, who among you actually can tell me one distinct characteristic of women's products that we used to see 20 years ago? They were all pink because to them, it was that all women are the same. Women are a homogeneous group. That is what they felt then. But women are not the same. Women, every woman in this room, we all have different life experiences. We have different life opportunities. We have different financial needs. So is it then fair to design one single product that speaks to all the women? And bearing in fact that all the women here are probably educated, but by the time we even take it to rural women, small older farmers, we take it to retail traders, we take it to women that are, that are on the farm, that are breaking their backs, women that are roasting gari, women that are on various value chains. The question, that is where the intentionality comes in. And that is what we call human-centered design in financial services, where we have a system in which we are identifying the various women's segments. And this is where we also work with financial service providers, like you mentioned when you were talking about product design, and it's like a song to my ears when I heard that. Product design, and in this product design, it's like walking from on the unknown to known. Like not assuming that this is what you know about this woman. For me, probably what the financial service that I need is for me to be able to get a mortgage from him because I'm upwardly mobile and I can afford to have a mortgage. But from a woman in the rural community that has a small plot of land, she probably needs a crop insurance. She probably needs a savings. She needs to plant in the next rainy season. So she needs to buy seed. So she needs money for that. And that is where it is important. We cannot do this work without the financial service providers. We need to collaborate with them for them to understand that, number one, there's a business case to serving women. You see, when it comes to health insurance, we can't talk about women's economic empowerment without talking about the health care for women. A woman that is not healthy cannot be economically empowered. Because when we talk about women's economic empowerment, We are talking about 3 areas. We are talking about agency. That is my power to own resources. We are talking about a woman's power to use her voice. We're also talking about choices. And you mentioned that
is when designing your products. Now, I know that you have different products that are targeted for women. Now, how do you ensure inclusion and sustainability for those women products, that they actually serve their needs? And how do you create more products, basically, to the ever-growing need and ever-diverse need of women in society today?
Thank you, Rhoda. Like I said earlier, as a person, I evaluate the products that come before me relating to women from the home, because I have a focus group right there in the house. So, also in the office, we are 226 staff members in AG Mortgage Bank. 117 of those are women, representing about 47 to 48%. That's a good number to work with. And it's showing forth in the things we do around women. So we also use that population within the bank as a bouncing board to determine what the market is likely to do and how inclusive that product will be to women. But besides that, we're also lucky to have an anchor investor in the Assemblies of God Nigeria. And you know, women are more in the churches than men. So we also reach out to them in the churches and speak to them. I think the important thing is meeting them, meeting the women where they are. Have a direct, straight conversation with them on what the needs are. And we have done that. We have also been able to create specific products that speak to them. For instance, you talked about mortgage. Women, because of their other engagements, the woman is more likely to, yes, we help them do capital formation, savings, investments, but you find out that if the child's school fees is delayed, she reaches out to that to pay the school fees. But we are coming to that because we are also doing some training, which I would which I will focus on later. But what we do is we have created, for instance, a mortgage that speaks to the needs of women. A mortgage product we call LIMO, Leap Into Mortgage. It's an incremental kind of mortgage that you can start by borrowing a little to buy land. Once that is addressed, you take a little to start something, maybe the foundation. And by the time you know it, you now have a house of your own. So we are, by this product, encouraging women to own homes. And some of them are latching onto it. We also have a product we call FEMSA, for family savings, so that you introduce savings even to the children. I normally use my kids as, well, they are no longer kids, they are women, now, as an example. While growing up, during holidays, they work for me and for my wife, and we pay them. What has that taught them? That money is not given, money is earned. You earn money. And that has helped them through life. And again, we look at cooperatives, we work with cooperatives. Apart from churches, we work with cooperatives, we work with clusters. From there, we generate ideas as to what applies. Like my colleague here said correctly, no two women are alike. We've learned that. just like no two men are alike. So we try as much as possible to reach out to them where they are, speak to them, and then come up with those specific products that speak to their needs. Like the micro loans that we give. We don't just give micro loans. We ensure that people are prepared to receive micro loans. Otherwise, you are creating more problems for the women. Thank you, Rhoda.
Thank you so much, Seth, and thank you for all that you're doing so far. We have very little time left, so our question and answer session will be very, very brief, so we might only be able to take 1 or 2 questions. But before then, I'll just go to Ini and ask that, now we've heard a lot about the different challenges that women face. Now, how can we actually change the narrative surrounding women's health and finance with the creative platforms that are available?
Say that. Can you hear me? Okay. Our major target should be equity, and that means not just treating everyone the same. And like Tolulokwe rightly mentioned, we are not the same, and it is very important that we recognize the unique barriers that different women face and experience and address that specifically. So whether it's through policy change or community outreach or digital innovation, it's important that we strive to ensure that every woman, regardless of where they live, their economic status, their cultural backgrounds, it is important that we ensure that they have access to care and the financial resources that they need to lead a healthy life and an empowered life. So basically, in a nutshell, we need to create a system where no woman is left behind.
They keep passing me notes.
5 minutes more, 15 minutes more. I keep seeing it and I'm like, stop them. Even I'm under pressure to talk quickly because I can see your notes.
I'm going to cash all these notes in. Okay, so I'll just rush it now. Forgive me. But now, what do you think the next steps are, Dr. Session, in actually integrating digital health and affordable healthcare for women and their access? Please, as fast, so we can at least take 1 question.
Okay, thank you. One very important thing that we need to do is there is need for integration. Several efforts are currently underway in terms of trying to improve access of women to like health insurance. But how are we, as much as possible, integrating all these efforts such that it also covers for providing telemedicine services? So we need to look holistically to ensuring that as we are upscaling different interventions, trying to expand access for women, we also think about innovative means by which we can reach them. That's the one thing I think I want to end with. Thank you.
Okay, thank you, sir.
Oh, okay. Yes. Good morning. Oh, they needed to record. Good morning. So I wanted to ask, how can government policies better support the intersection of maternal health, financial inclusion, and digital innovation?
Okay, thank you. Government policies, I think my last ending statement, it was one very good one in terms of ensuring that any health insurance package that's coming out provides for people to be able to consult remotely. There are a lot of challenges in terms of like data restrictions, in terms of how can we ensure privacy through when somebody has a remote consultation. But even we need to start from somewhere. Like we need a policy that says, every health insurance plan should be able to provide people as well through to access services, through telemedicine. So that's one very important government policy that I'm not sure it's currently in place. But if government puts it in place, it's going to really ensure and bridge that gap. Thank you.
So I also just wanted to quickly add something to policy, because everything rises and rests with the policies, with the regulatory authorities, and that is also where capacity building is very important for the regulatory authorities also, for them to understand this segment, to understand what these issues are, because oftentimes we think that the government knows it all, and because of that they are able to better put in place right policies. But oftentimes, and this is what we've seen across the 10 African markets where we are working right now, that most of the times the government do not know. I'm so sorry to say that, but that's the truth. And they need to know, they need to understand why they should put in place the policies and why they should support the private sector. You mentioned national health insurance. Why that seems so fantastic to have a national health insurance? Is it realistic to have a government-backed national health insurance in this sort of climb? I don't think so, and that is why the democratization of health insurance must come in, and this power has to be given to the private sector, but they need to enable and they need to provide an enabling environment. That is it. Thank you.
Okay, on the financial side, the authorities have actually started some policy initiatives to expand inclusion. And it's one thing to make policies and another to set criteria for evaluation and implementation. I think that is where the weakness is. Now the central bank has talked about financial inclusion. They are asking the financial institutions under their purview to ensure that the spread go to the rural areas, open accounts and all that. And they have also gone further than that. They scale down entry requirements for certain class of accounts, which makes it easier for the woman in the street to open an account. But the truth is that most times you don't have specific criteria of enforcement. And that is probably where advocacy can also help us to ensure that government does what it says. Like we say in our company, don't tell me, show me. It's better you show me than just tell me. So advocacy could help heighten the distinct, raise the stakes.
Oh, okay. That's actually a perfect segue into what I was going to say around advocacy, and that's a great question. Thank you for that. Currently, we're working with the Ministry of Women's Affairs on domesticating the newly launched Women Economic Empowerment Policy, and that policy actually has one of its major pillars as financial inclusion. Also, within the policy, it requires for collaboration across sectors, specifically working with, in fact, the development of the policy was by the Ministry of Budget and Budget, Finance and Planning from the previous administration, and continues actually to be driven by stakeholders in the current administration's Ministry of Budget. So such that we have a mandate, right, to develop budget, gender responsive budgeting, right, in different states. But like he said, advocacy is so important, because I know people within the government, I know senators who don't know about this policy, talk less of the average citizen. So the citizen doesn't know about this policy, they don't know how they can actually access, right, the rights that they have, right, which is included in this policy. The private sector doesn't know about this because they also don't know about, the things that that the government can support them in developing products that can help empower women across these, different sectors. But also the citizens themselves need to also be aware. Right? So this is where, like he said, advocacy comes in. This is the work that we do when it comes to communications. And right now we're extending an arm to actually everybody in this room and anyone that's listening to this, join us in supporting, the domestication of this, because you first domesticate, which means that at least this policy is within the government's, purview to implement, and then we do implementation together, working with private sector stakeholders and everyone in our civil society. So thank you.
Thank you so much. Please, a round of applause for our panelists. Unfortunately, we have to end our discussion here. But I'll have our panelists give a brief 30-second final word. I'll count in my mind. So, 30 seconds, what do you think the most important target is to ensure that all women have unhindered access to quality healthcare and financial inclusion? So I'll start from Ini and then we'll go down. 30 seconds and counting.
I actually briefly mentioned this in my last answer, and it's basically, what we've been mentioning. We're not all the same. Through policies, through community outreach, through digital innovation, it is important to address specific, the different to understand. Sorry, this is working. Thank you. Hello? Yes. So I was saying that through policy change, through community outreach, through digital innovation, it is just important that we understand that women have unique needs, and we need to address this specifically so that we have access to the care and financial resources that we need to live like an empowered, healthier lifestyle.
Okay. Thank you. Dr. Session?
Thank you. As it is, for women, for us to improve access for them, we need to look more into policy. We need to look more into providing that enabling environment. Recently there's been effort to provide some funds for vulnerable women. Through the National Health Insurance Agency, I actually worked on a project that actually supported women with fistula. That particular opportunity provides some kind of funding to treat women who have fistula across the country. So that kind of funding that provides targeted interventions for vulnerable women and girls needs to be scaled, to looking at more than just women with fistula and other women that have such challenges. Thank you.
Thank you very much, Fife.
Thank you very much, and thank you so much for having us here today. I just want to say that information is power, right? Everybody needs to be educated about the policies that address women economic empowerment policy. So we have an initiative called We Lift Nigeria, which is Women Economic Empowerment. Lift Nigeria meaning that if women are empowered, then Nigeria will be lifted. And so please stop by our booth. It's here, right here where all the booths are, to scan the barcode and get your citizen's guide to this policy so that you can understand better and know exactly what is available for you as a citizen. And you can also hold your lawmakers and the government accountable for the things that they've made promises on within this policy.
Okay.
Thank you.
Thank you.
I would say collaboration. Collaboration, collaboration, collaboration. When we collaborate, we solve problems. That's key. And secondly, like we do in AG Mortgage Bank, we are paying attention to the younger women. So as they grow, they take all of these, they grow with a new generation that understands inclusion. Thank you.
Thank you very much. And you've all said what I wanted to say, so that is very good. But one thing that I wanted to say is more like a charge. It is no longer acceptable to have 500 maternal deaths per 10,000 live births. It is no longer, it's not acceptable. So next year when we are all sitting here, by God's grace, we do not want to be having this conversation. But for that to happen, we have to ensure that we are working with people like him to ensure that we have enough financial services, health insurance, savings accounts, credit facilities for women so that they can be empowered to use health, to make timely health decisions. And for us to do that, I would say that we necessarily do not work in Nigeria, but we work through EFINA in Nigeria. And we'll be myself and Sophie. Sophie is here. Sophie, say hello to everyone. We are here and we would like to have conversations with people. But thank you, Rhoda, and thank you to everyone.
I stole the mic because I just wanted to add one more thing. I don't like this mic. I like this one. And I love that we are here and we are creating awareness, but I think striving for more like lasting change is very important. And I just want to just give a brief example. So I'm very passionate about fibroids. A couple of people might know. And, you know, it's beautiful that now we can talk about this women's health challenge that affects 80% of black women. But till today, we still don't know what causes it and how we can treat it. So also, it would be great if the public and private sector can, you know, help with R&D, research and development, to really understand why our black women, 80% is a triggering number, are suffering from fibroids, PCOS, endometriosis, the list is endless. So just also pushing for that would be great. Thank you.
I join in your hatred for this microphone. So thank you all for staying with us thus far. Thank you to our wonderful panelists for such invigorating discussion. And a lot has been said today, a lot has been shared, and I hope that at least we've taken one or two things that we can go forward and kind of continue this discussion. And of course, if you want to speak to any of the panelists, you can still meet us here at the end of this panel, or you can come to our booth. AJ Mortgage Bank has a booth and the exhibition area, as well as Hasty, so you can learn more about the work that we also do in economic inclusion and women's health, especially reproductive health care, which is very, very crucial for women. So thank you all once again, and do enjoy the rest of the summit.